Ms. Washington. It's Dr. Buford. Just getting started on the left shoulder. We're looking from the back to the front. Everything that we see is magnified 30 or 40 times on the screen. Right off the bat, we can see that this biceps tendon has some fraying at the insertion site here. So we have to decide if we're going to release it, just because sometimes when it's tearing here, that can cause pain. So I think we will release that. It's called a tenotomy. Your biceps has a couple other tendons, that's why we can release this. And actually, there's a good sign of why it's hurting. You can see there's a little area up higher that's a little partially torn as well. Scissors. Once you get it started, we can use a pair of scissors. And there it's released. That won't bother you anymore. Now we'll look up at the rotator cuff, and this so far is pretty good news. The insertion looks pretty good here. So I'm actually happy with the way that looks. We'll go off on the video and have a look at the subacromial space. Pause, please. Okay, we're just about finished taking off the bone spur. It's not too big. This is it at the top of the screen here. And now we're going to get a good look at the surface of the rotator cuff from this angle. As we look down, we can see the anterior portion of the cuff. Looks fine. And then as we rotate and look back towards the posterior portion of the cuff, we just want to confirm that there's no what we call a bursal-sided tear. So far, so good. So I don't see anything else significant that we're going to have to repair or remove, so we're just going to make sure there's no bleeding or anything else, and then we're going to wake you up and get you back to the recovery room. So we took care of the biceps tendon. I'm hopeful that that was the main source of your discomfort, that and the bone spur that we just took care of as well. So good luck to you now. Bye-bye.